The risk of stroke for African Americans is up to 4 times higher than for non-Hispanic whites. This is due in part to higher rates of high blood pressure, diabetes, and obesity among African Americans. To watch this program again, or to watch other programs in the Healthy Body, Healthy Mind series, please visit our website at hbhm.tv.
Okay. Which side do you hear this on?
I like both.
Shrug up your shoulders for me. Shrug them up. Yeah. Good.
For many years, Dr. Mark Alberts has played an important role in making sure that stroke patients get the highest quality care possible, no matter where they live in the U.S. The result of this work is the creation of certified stroke centers.
Good. Let me have you tap your fingers like this for me. Many years ago, a group of medical professionals, including myself and many others, got together to formalize the concept of a stroke center. And what that is that it's a hospital or a group of hospitals that have the facilities, the expertise, the protocol, and the experience to diagnose and care for all different types of stroke patients and make sure that they have a good outcome, that we reduce the death and disability associated with a stroke, that we reduce the in-hospital complications related to a stroke.
Today, there are 2 types of stroke centers. Comprehensive stroke centers, where patients with the worst types of stroke get care, and primary stroke centers that provide initial acute care for most types of stroke.
The Joint Commission has certified about 500 hospitals in the country as primary stroke centers, and state health departments have certified several hundred hospitals also as primary stroke centers. So that's what we mean when we talk about a certified stroke center.
Our guidelines are pretty much along the lines of trying to have organizations set up a system or a process of care to make sure there are protocols in place and that there is a process in place for monitoring the effectiveness of these systems that the hospital or the healthcare organization puts into place.
People who live in more rural areas of the country don't have access to hospitals that specialize in stroke treatment.
No respiratory distress. She's standing well on the monitor. The vitals are BP 100 over 62, pulse is 104.
And that's where the concept of telestroke comes in.
Okay, perfect.
Telestroke is a very important concept. What it is that it's using cutting-edge technology, basically real-time communication and the ability to transmit images over the internet. And these are images of the patient sitting in a bed, maybe in an emergency room or in another hospital, being examined, as well as images of brain studies, such as a CT scan or an MRI scan. So the concept is that we can use telestroke to actually see what the patient looks like clinically, to review the CT or MRI scan.
As the technology continues to advance in the treatment of stroke, more and more patients are receiving the highest care possible. For patients like Shelley Powell, who have not experienced a stroke but need the benefits of anticoagulation therapy to possibly avoid one, life can go on as normal, with a few variations. That's because a cut or traumatic injury could cause her severe bleeding issues.
My lifestyle has changed, but in minimal ways. There are a few activities that I used to do, like bicycle riding or even occasionally horseback riding, that I don't do anymore because of the risk of bleeding and bruising. Anticoagulation, I think, is not as much of a challenge as it is a matter of using common sense. I think you need to live moderately. Other than that, unless you have a very physical lifestyle, I don't think it's a major inconvenience or problem.
Try to figure out what I was going to play that day or something.
As for Philip Strubig, life goes on as well. He's off of his anticoagulation therapy and is now on aspirin therapy alone. But recovering the dexterity in his hand and arm caused him some concern in the beginning of his recovery. His love of playing music was something he did not want to put aside.
After my stroke, came out here and try to get the drum thing going so I could at least play a little bit and see what's happening. What's going to go on now is you got 4 things going on, so I'll show you what's happening. 1, 2. In your right hand, you got to go twice as fast as your right foot. 1, 2, 3, 4. In your left hand, you got to do on 2 and 4. Ouch, this is hurting me. That's what you want. Then you start mixing up. What you get. Woo!
Remember, just as Dr. Alberts has said, when dealing with the possibility of stroke, take the symptoms seriously and seek medical help right away. Doing so can make recovery much more successful. Well, that's it for this edition of Healthy Body, Healthy Mind. I'm Dr. Scott McFarland. See you next time. To watch this program again or see other Healthy Body, Healthy Mind episodes, please visit our website at hbhm.tv. To answer any specific questions you have about thoracic aneurysms, be sure to contact your healthcare provider. To comment on today's program, please call 888-380-6500 or email hbhm@itvISUS.com or visit our website at hbhm.tv.
Major funding for Healthy Body, Healthy Mind is provided by GE Healthcare, helping to predict, diagnose, inform, and treat so that individuals can live a full life. And by Teva Neuroscience, quality people, quality products, patient focus. Additional funding provided by Ortho McNeil and by Amgen and Wyeth and by Genentech.